think we're at noon, so thanks everybody. And I guess we're in another new Biology Clinic Roundtable on pain management, joined with Becky and Adam. And I was thinking about this not too long, but because I don't think I ever dealt with pain management in my years. When people came to me with pain, I would always say, I don't know what you guys think of this. You can't, like, especially it was like cancer. And I would say, well, you can't treat pain without treating the problem. Like, that didn't make any sense. Of course, you can block the pain with opiates and stuff, and maybe even cannabis, although I never got into that. Um, but that's not, I don't think, what we're talking about here. And so, the question is, where does pain come from? Now, we're told it comes from nerves, that without nerves, you don't feel pain. And I was thinking about this for a minute, and I think it's one of the few things that I heard growing up and in medical school that actually may be true. Because it is true that if you cut somebody's nerve to a certain place, then they don't feel the pain. So I would say that's reasonable evidence that without nerves, you don't feel pain. I don't know if you guys would agree. So there's something about a nerve. So then we've talked about a nerve. Nerve is basically a tube of organized water that carries electrical impulses. And then I thought another evidence for the relationship between nerves and pain is if somebody has pain in their finger, for instance, and you put a local anesthesia around the nerves that go to your finger, like here and here, then you don't feel the pain in the tip of your finger. Now, it is also true that you didn't actually put the anesthesia in a nerve, right? You put it in the spot. And there's other things there like blood vessels and tendons, maybe. But so that doesn't prove it's a nerve. But I think that also suggests that it's blocking the nerve. So, what does it mean to block a nerve? It means that you've disrupted its ability to carry an electrical impulse. So, I know this guy who's supposedly writing a book. He's an anesthesiologist on how anesthesia works because they don't really know that. And of course, being the smart aleck that I am, he said, "Oh, I'm writing." I said, "Oh, I know that," which pissed him off because he's been researching this. But again, Adam, you know a lot more about this. Anesthesia are mostly highly polar compounds. And therefore they diffuse into a watery structure and disrupt its ability to create a gel. And, water doesn't conduct electrical impulses very well. So then, and also when you use local anesthesia, I did that a lot, it would hurt going in and then it would stop hurting, right? Then it's numb. So you're basically putting a polar, which means a sort of charged chemical into the gel that makes it into a kind of a puddle. And when that's happening, it hurts. And then it's a puddle, and then it don't feel anything. And then it regenerates itself and forms into back into a nerve, and then it feels again. So why does that? So something similar, there's a disruption of the electrical carrying capacity in people with chronic pain. So what's that from? I think there's actually a pretty reasonable model that there's probably a stagnation of the flow of energy in that area. And it's probably related to a kind of inflammatory response related to either swelling, or it could be emotional, or it could be injury, or it could be disruption of the tissue or something. Like you fall, sprain your ankle, you get swelling, it hurts. That disturbs the, it's like that first phase of the anesthesia, and you get a disruption of the electrical activity from the nerve, and that creates a kind of stagnation. And when it becomes chronic, it's like a chronic stagnation, inflammatory response in the tissue. Or it could be severed. But if it's severed, then you don't feel anything. So I think that's a pretty simple model. So when you're trying to not have pain, you're trying to restore normal flow. I think it's as simple as that. I happen to, not that I keep picking on this guy, but I'm going to keep picking on him a little bit. The reason I wanted to say this, that our whole new biology thing, I think, is saying things and explaining things in a way that makes sense to just about anybody, and that leads to actions like restoring the flow. So you might want to massage it, or you might want to put something there that decongests the tissue and helps restore the flow. You might want to move it in a certain way. You might even want to add cell salts or homeopathic medicines to restore the flow. But we have a very it leads to sort of personal action and understanding, and I would even almost use the word sovereignty, as opposed to this. And this is sort of what we're dealing with, particularly in the alternative world. So I happen to find this on Mercola's website. So here's what he's saying is the cause of chronic pain and inflammation. That was the title. So a gene called MRC1B, which has direct human equivalent MRC1, became sharply suppressed during chronic inflammation. The gene provides the blueprint for the mannose receptor CD206, a surface protein that marks macrophages committed to tissue repair. In healthy animals, MRC1B was strongly expressed in clustering and muscle encasing macrophages. And then it goes on. The signaling pathway responsible for this suppression involves a protein called MYD88, which act as relays inside immune systems, transmitting inflammatory signals, et cetera, et cetera. And then you say to yourself, oh, yeah. I knew it was. I knew all along it must be my MRC1B mixing with the capsaicin, and by golly, that must be. And you what you've become is a victim. You don't have a clue what he's talking about. He doesn't have a clue what he's talking about. And you become paralyzed. And the only result of that is to outsource your power and your actions, because somebody must know this better than you do, because you certainly don't know. I mean, I don't know what he's talking about. And we don't want that. We want, okay, if there's an injury or some event that happened to create stagnation in a certain area, and we're going to work on moving that stagnation, and you'll feel a whole lot better. I'm going to stop there so I don't get myself in more trouble here.
I'll just say I agree, and then Becky can take it from there.
Yeah, I agree. And just
Yeah, stop.
thinking about it from more of an anatomy perspective, I mean, your take on it makes a lot more sense and I think is easier for people to understand than getting down into the gene nitty gritty. So you guys did a panel quite a while ago on fascia. And so whenever we're talking about chronic pain, I can't really think about this problem without thinking about fascia and why it's important in the body. So fascia is just, I describe it almost as like the saran wrappy type tissue that covers all of our different things in our body, muscles and joints and all sorts of stuff, and it connects everything. Part of that connection is like that communication. So that signal movement from point A to point B, that could be the hip to the knee or vice versa. But the nerves also run through that fascia. So if you have chronic inflammation, that fascia gets tight. If you're not moving, that fascia gets tight. There's a lot of reasons why that tissue gets tight and it kind of clamps down. So that will pull on the joints, but it also crunches the nerves, just to kind of put it like in a very basic model. So one of the first things that we typically tell people that have chronic pain, and if you look at the evidence, this is what typically has the most benefit for most pain syndromes, is you have to move. Even if it's painful to start moving, you have to get moving. And I think fascia is the reason why that works so well. So I think I see a lot of arthritis in my clinic or whatever we call arthritis, but arthritis is such a funny thing to me because I can look at imaging and someone can have what they consider like bone on bone end stage arthritis and have no symptoms at all, no pain. And then I can have someone that has minimal changes or no arthritis and they have excruciating pain. But in that model, that person that has pain, regardless of what their joint looks like, when they start moving, that joint typically starts to feel better. You haven't changed the changes in the joint itself, you've changed the movement pattern and the signaling around the joint. So that can be really important and just such a great key for, okay, even if it hurts to start moving, doing things that are real low impact, like Pat Daly's videos are so good because they just get the body moving in a way that's not going to put more pressure on the joint. It supports the body and motion around the joints. So I think that's a really great tool that we have on the platform. And there's more stuff on YouTube that I will throw members like, hey, if you get done with this, he's got more videos over there too. So it's a pretty cool resource.
So in other words, it's really about moving the stagnation in a way.
It really is. Yeah. And just stopping what's compressing or stopping what's physically blocking the flow. I mean, there's a lot of different ways to move that stagnation, but there's a very physical thing that members don't need to know or understand a lot of pathophysiology or anatomy to understand. If I move, it's going to free up that tissue and that restriction around those nerves, around those joints.
That, yeah, they don't need to understand it because the fact of the matter is we don't understand
We don't
it
know. We don't know exactly how it
either.
works.
Nobody understands it. They're just making up a story.
We
Uh,
just know things are connected, right?
and what isn't a story is if you do something to hurt yourself and you feel pain, the last thing you want to do is just sit there for a week because
Right.
it will not get better then. Whereas if you may not want to do exactly that movement that or that activity or whatever it was that caused the pain, it may be too much of one kind of movement, right?
Yeah.
That's a problem too. I actually I don't know what you guys think because you know more about this too. I think that's one of the, when I grew up, it was rare for a basketball or a baseball player to miss an important game because of pain or injury. It just didn't happen.
Yeah.
Like
Hmm.
Dave Bing never missed a Detroit Pistons basketball game when it mattered. And now it happens all the time. It's like that's part of the equation. And I think it's abnormal kind of movements too much, same thing over and over and over again.
Well, compounded
Yeah.
with all the other stress and toxins that they're getting themselves into, whether
Yeah,
it's on the court or outside in just everyday life. Like, what are they putting
yeah,
in their bodies? How much are they on cell phones and other devices? Like, what does their living
yeah,
environment look like? I mean, a lot of them are traveling a lot, so they're getting
yeah,
exposed to things. So, yeah, I think
yeah.
that helps compound the stress on the body.
And we didn't used to like walk on treadmills and stuff.
Yeah.
And that's so repetitive, so unlike walking in the woods and
Yeah.
doing stuff in the woods. But Adam, go ahead.
Yeah, I was just going to start off saying, man, I wish I would have talked to Tom and Becky before I started practicing, chronic pain management. Because I'm not kidding. So I, our
Yeah.
training, right? Medical training, 13 years after, by the time I got out of fellowship from high school. And then I practiced for over a decade as a, chronic pain specialist. I'm an expert in pain. And I definitely didn't see things, from a perspective or believe things because it never makes sense when you're talking about genes and this chemical and that chemical, and it's all this kind of stuff you can't see, right? It's just in textbooks and it's make believe. But at the same time, I've come to the same conclusion, since leaving practice almost 5 years ago, is it's pain. If you had to describe pain from a like mechanical or mechanistic perspective, I would describe it how Tom did. It's stagnation at its core, right? And there's many different ways, right? It can be compressive. It could be an injury where there's a tear in the tissue. It could be an injury to the nerve. It's tension, like again, Becky saying so much of pain is people, emotional tension manifesting in muscles and fascia, and that tension is creating stagnation. So I think that's probably the best understanding I've been able to come to. And it's a lot simpler than studying 13 years of a bunch of nonsense. So pretty fascinating. And then it becomes so again, I think one of the key things of pain is it generally serves a purpose, right? It's not this, because generally how we look at it in medicine is how do we make it go away, right? So you're given painkillers, you're given opioids, or you're given NSAIDs. You might see an anesthesiologist, they might do some injections, they might do some type of electronic ablation, ablating the nerve, kind of stunning the nerve. All those things are kind of like, stop bothering me, right? And I don't think there's anything wrong with considering to try to give some alleviation in a natural way. But if we understand that this is a communication from the body, actually is a benefit, right? Either survival, again, acutely, you're touching something that's burning, you withdraw so you don't continue to damage the tissue, or freezing, or right, or you cut yourself, right? Those are all serve a purpose. And in a chronic setting, it can become a lot more complex because it may not be just a physical touching a burning stove or a fire. It may be traumatic experiences that are overlying, because that's the harder part, and that might be the bigger part that we see today in our society is, different traumatic experiences and conflicts. We see people come in, I have my whole body hurts, I have pain all over. There's not a physical explanation for that, right? And so modern medicine tries all these pharmaceuticals that all fail. They all are mind altering. They turn people into a shadow of what they normally are because they're affecting their mind and dampening them, and they're not effective because they're not addressing the root cause and addressing their life story. What has happened to me? Let's look at what's happened. What's my experience and when did this develop? And so these things can be from early on in our lives and they can carry on throughout our life. But the emotional, right, being in fear, anxiety, that tension that it brings in the body, if we just try to alleviate it, make it go away, we're doing a disservice to what's going on. So
Yeah,
Yeah.
in a way, it's like fear is the toxin then,
mm-hmm.
and safety and life is good is the therapy. But the tricky part of that is you may have learned to be afraid for a good reason. And even if that, abusive father isn't there anymore, they're there in your mind. And somehow it needs to be identified and healed. I was going to use the word extricated, but healed is better because you need to come to a relationship with it somehow.
Healing is not forgetting, it's healing the trauma.
Yeah.
I think you guys have hit just such an important part, especially with chronic pain. People will get stuck in their pain patterns. And the best way for most people to get unstuck is to go back. So, Tom, you always talk about like, what's the story? So, go back to how did this trauma start? When was the last time you felt good without that pain? And then figure out what actually started that pattern. and then help them deal with that emotional component because that will help them be like essentially unblocked to actually start that healing process. Because everything from like you can do physical therapy, you can do all these modalities, but if you're stuck and you're not able to move forward in that healing process because of this emotional trauma, like PTSD is what they call it in mainstream medicine a lot of times for whatever reason started that pain process, it's really hard to move forward regardless of what modalities you're throwing at your pain problem.
And one of the most powerful experiences I had when I was practicing pain management was people that would come in with debilitating pain, right? And sadly, they get the runaround, right? Because most of these people that they were coming in, they were, to me, they were very miserable people, right? But they would go see a neurologist, they would do their workup and check out their nerves and do imaging, didn't find anything, get sent to the next specialist, see a rheumatologist. And then anyone say, well, you're just making it up. But you sit down and actually talk to the person, and they were not living a good quality of life, right?
Yeah.
Ultimately, they were suffering, whatever you want to call it, right? And so I always believe people, and then you can do things maybe over time to verify. And
Yeah.
certainly over time, you're pretty good at when people are making it up, right? You can see that they're very inconsistent, with what they're experiencing, and they'll show when you're very good, you can pick it up almost the second they step into the room after doing it for years. But it was what was really impressive with people come in that were in severe pain. And we had, again, it's all, there's certain algorithms you have to follow when you're treating someone with pain. You have to document their levels and you're giving numbers, which is a very kind of poor way, but it's kind of a gross way of what's your pain level. And then, so before I'd see the patient, I grab their chart and, oh man, they're still, 9 out of 10 pain and going there, just kind of heavy heart, what we're trying wasn't working. And there was a certain amount of people that would, they would start bawling. You walk in the room and they're like, you know what, you've changed my life. And I'd be like, what are you talking about? And they're like, you're the first person that ever cared about how I'm feeling. So even though they were experiencing a very difficult time and pain, which is obviously a very unpleasant experience, there is something, even though I didn't have tools maybe at the time to offer them, or what they were doing wasn't, obviously helping their pain significantly, that emotional aspect is so important. And I think when we're looking at any type of pain, I think bringing that in is so important, right? Again, like Becky's saying with Pat's movements and these type of things, it's stagnancy. We want to try to get movement in a healthy way, depending what it is. It might look different, but also there's this state of emotion, our own emotional state, right? I love working with when I worked with Pat, is that when you start to bring yourself present, right? Because if there's all these fears about and the things haunting us from the past, and the fear about I've been years, every time I do this movement, I'm having severe pain. So you have this anticipation. It's a potential fear, right? It's a potential damage, but there's not, right now, you're fine. If you can get present and just breathe and move in a very slow, controlled way, like Tom said, you put yourself in that safe place. All of a sudden, it's amazing how many people could start to, okay, they're reassuring their body. There's nobody hurting me right now, right? I'm not thinking about the future. I'm just present. I'm breathing. It's the most physiological, mechanism to really relax our nervous system and our body, right? To balance it, and a really slowed, controlled movement through whatever is painful. And again, that can do so much for our emotional state. If you have a physical injury, it's not going to heal your fractured bone per se. But again, with a lot of chronic pain, with tension, I think that's a very simple, sound approach to trying to work through that. So it's very powerful.
Yeah, it really takes the body out of that fight or flight. The body gets stuck in these fight or flight patterns when they're in pain. And the more you're stuck in that, like, I'm just chronically stressed, I'm chronically in pain, I'm just chronically like afraid, then the pain patterns actually exacerbate significantly. So those little things aren't little at all. It's those breaths that can actually, they're doing more than moving the tissues, but they're also calming the nervous system down and bringing you back more into a rest and digest so your body can heal. because it's in that more rested state or calm state that your body can employ more of the healing factors. So even outside of just what we've been talking about with movement, which is super important, I think getting the body into a more parasympathetic or more rest and digest type state can be so helpful for a lot of people.
It reminds me of two things that people would often ask me, like, sh you know, this, should I worry about such and such getting cancer or a heart attack or so? And I always used to say, you shouldn't worry about it, because if you worry about it, you suffer now, and then you may get a heart attack, and then you have a heart attack, and then you suffer with the heart. So just wait till you get a heart attack, and then you only suffer once. Of course, one could do something about that, so that's not the outcome. But the worrying, or we could say being afraid of
Mhm.
something, already makes you suffer, even if that thing never happens. I'm afraid if I move, I'm going to, so you're already suffering, then you have to suffer twice. And the other thing, and I think this is so important with these people, Adam, you were talking about, there was such a thing in the people that I saw of wanting to know whether it's in their mind. Is this all in my head, they would say. Because usually they'd been told so many times, there's nothing wrong with you. It's like this thing that I now have, somebody said, you go to a doctor now, you go to a doctor, you get 2 minutes to tell your symptoms, then they take some part of you, put it in a magic box. The magic box spits out what you're supposed to do, and that's how we do medicine. So what I used to say, if somebody says, is it so if the magic box says you're fine, then it's in your head. And I used to ask people if they could tell me where their mind starts and their stops and their body starts. Because if they tell me that, I tell them which one it's in. And nobody could do that. I can't do it. I don't know where my mind stops and my body starts. It's all mixed up together. And so it's a severely misleading question.
Mhm.
It's just you. That's where the problem is. It's your life story, and it's just you. And therefore, we can do something about this. We can choose a different path, a different story. We're not going to worry about it. Worrying doesn't do anything. You're going to do something like eat differently or move differently or put a castor oil pack on differently than you used to. And then because we have the best magic box of all, which is the question, what happened when I did that?
Mhm.
I felt better. Oh, the magic box says castor oil packs helped. So we're good. And then you do it again. And if it didn't help, you don't do that anymore. I don't know if,
Yeah, it's interesting. Pain is so multifactorial. I feel like some people, so Adam, you were talking about the pain score, and people would come in, they're still at a 7 out of 10 pain or whatever their number is, and that scale hasn't moved. When I was doing more of that, just kind of burning and churning with patients and seeing a lot of those pain patients in my own clinic, I would see that and I would walk in the room and ask the question a different way. And it's interesting how differently people would answer. So I would tell them, okay, if you think about your pain from the first time we met to how it is right now, on what percentage, and zero is it's no different at all, and 100% is it's gone, which I know it's not, but what percentage would you say that it's changed and how has it changed? Then all of a sudden I would get answers like, oh, well, it's 50% better. I'm like, but you just told me that still at a 7 out of 10. They're like, well, it still hurts, but I can do X, Y,
yeah.
or Z, or I'm able to sleep through the night now, or there's other markers to show that they're improving. And that can really help people move forward too, because they don't feel so stuck in like, oh, I'm still a 7 out of 10 pain. It's like, oh, actually, there has been progress. My body is responding and it is healing. And that just that mentality can help them continue to move forward.
Yeah. And that reminds me, I'm sure you saw this also a lot, Adam. Person comes in chronic pain, and you ask them, you guys may not have even asked, how's your life? I'm having trouble at work and my wife's disgruntled and I'm losing money and et cetera. Okay, so you're in pain. So you give them opiates. Oh, come back a month later. Oh, pain's a lot better. How's your wife? Yeah, we got divorced. How's your job? I got fired. How's your finances? I went bankrupt. But their pain is better. So we're good. But now they don't have even the motivation to do their life.
Hmm.
And that's called a good outcome in conventional medicine. What's happened is we numbed them.
Yeah, no, I think that's the sad reality of most of allopathic approach to pain, right? That's what it does. It disconnects you from your life.
Your life, right?
That leads to major issues. And so my goal was always to get people off the painkillers, especially, avoid unnecessary surgeries because there's, plenty of surgery done for pain issues that are unnecessary. And not saying there is time and place for potential surgery, but again, way overdone. So maybe on that note, just thinking of a few other like modalities, like we talked about actually moving, right? So we're moving our tissues, we're moving, fluids in the body. We can do different movements to help lymph, right? Drainage. If we have stagnation, there's buildup of toxins and waste in the body, that can lead to pain. That's also helpful. Certainly frequency, light, right? Being out in the sunlight and nature, moving, grounding, those are really actually credible. And then modalities like infrared therapy, like Gerald Pollack's work is showing that has an incredible structuring effect in the body and will help to move modalities. So that could be with a sauna or, infrared device. I think I really see a huge place with that, with a lot of pain issues, especially musculoskeletal issues.
Yeah.
Um, and then natural remedies. There's different herbals that we see that are helpful that I think work, or homeopathics that actually work not by suppressing, like an Advil will, suppressing the healing response, so inflammation goes down and pain feels better, but actually work along with the body naturally. The way to use them is a lot different in my experience than, over the counter, even these over the counter pain medications, because those are toxic to our body. And so you have to be very careful every 8 hours for like an Advil, can take out your kidneys. This, Tylenol affect the liver significantly. But using something like arnica, if you use it, very like loading it every 10, 15 minutes in a severe pain, I've seen it work, as good or better than morphine. So it's incredible. There's a lot of amazing natural remedies out there, that can help not suppress the pain so much, but I think help the healing response. You have a huge injury, you have bleeding, you take an arnica, it's helping the body work better to coagulate, stop the bleeding, and help the healing response.
Adam, that's a great point about dosing, because we're all trained in the medical model, and so if you have an ear infection, you take antibiotics 3 times a day for 10 days. And I remember even in medical school asking, where did they get that number? Because actually with ear infections, I remember seeing a study showing that if you give it for 1 day, it has the same effect as 10 days. And nobody knew where they came up with with the 3 times a day for 10 days. It like,
It's the company that's selling it, Tom.
yeah, I mean, but they come up with these dosing schedules uh, but I also have found that, so we're afraid, like, okay, you give arnica, you got to give it 3 times a day for a week. But the reality is when I was to the point where I wanted to give somebody a medicine, there was something really wrong, and I would often give it every 15 minutes for 6 hours and then call me and tell me what happened. It's, oh my God, how can you give a medicine that? Well, because you could take the whole bottle every 15 minutes, it wouldn't do anything to you. It's
Mhm.
not Advil,
Yeah.
right? It's not an opiate. That's why you think 3 times a day is best. It's not like that. You can take turmeric a glass every half an hour. Nothing will happen except you might have diarrhea. Uh, but yeah, we get used to that, even though even that stuff, we don't know where it came from. Let me, yeah, let me get to some of these questions, see if you guys, advice for chronic knee pain and a weak hip. I mainly want to get to where I can walk comfortably. I use cell salts and castor oil. Either of you want to?
I can jump in on that one.
Yeah.
I would say the weak hip is probably more the problem, although weak hip can also have some different connotations from like familial relations and other things. So this might need to be explored from an energetic standpoint. That's where like doing some biofield tuning with Tatiana might really come in handy. But just from a pure structural standpoint, working on strengthening that weak hip with some of these, it doesn't even need to be like full-blown physical therapy, just some basic movements that are moving the hip in a way that feels good can be really helpful. The hip controls the knee motion. So I would, I mean, with all of my patients, it's funny. I had one gal get really upset. She came in, she was like, I fired my physical therapist. I'm like, okay, what happened? Well, I went in for knee pain. She keeps working on my hip. And I was like, okay, let's talk about how the body's connected. She was actually doing her job. I'm sorry you didn't understand that. That wasn't communicated. But yeah, the hip really does control motion of the rest of the lower leg. So I would say starting there and then exploring it from all avenues, like what happened to set it off and see if there was any timeline with something else going on in your life that needs to be addressed.
Adam, you want to?
Yeah, I mean, I think certainly, part of it would be taking a deeper dive with your, specialist to see, what the story is, and if you've gone through it already, revisiting it, right? Because a lot of times it's really beneficial after, you present it in a way that you kind of see it, and over time, as you're maybe looking at it differently, right? Instead of, again, I think it's natural a lot of times just in our society, let's make this pain go away, right? It's a nuisance instead of what is this telling us, right? And what's the bigger story? Because there could be a lot going on with any particular joint. Like the knee joint is seems like a basic joint. It's a hinge, right? In a way, but there's a lot of structures going on there. And then one aspect I don't think we've touched on so far, and I think it'd be a good time to bring it up with joint pain, is a lot of times these are inflammatory situations with joint, right? It can be an acute injury, it could be a chronic degenerative issue where the cartilage is wearing down. But diet has a huge part to play, metabolically, and can certainly be a huge part, so there's a huge part of that where people have different joint issues. And I cut out these processed inflammatory foods, cut out my processed sugar and grains, and voila, like my joint pain is getting better. Then, like I said, the movement part, there's a weak part here. You're compensating potentially, so working on that as well would be a great idea.
Yeah, Monica, would be remiss if we didn't say to add some meat stock and get that extra collagen in.
Bone broth, yeah.
Yeah.
Okay, can scar tissue from surgery over time result in increased blockage of the flow that Tom is explaining? It's interesting. Back 40 years ago, when I was doing bee venom therapy, there was a guy, Dietrich Klinghardt. You may know him. He used to say chronic pain was because of scar tissue, and he would inject bee venom into the scar tissue, which would lyse it, and it would end up going sort of back to normal, and a lot of the pain issues went away with that.
Mhm.
So I think yes, uh, scar tissue does inhibit the flow. It's like a crimp in your fascia, I think.
Yeah, there's so many ways that you can address that. And I completely agree. In my training, I was trained to inject anesthetic into scars
Yeah.
and free them up that way. I think bee venom is probably a lot more natural. But the response in the body is profound. And I found it wasn't always just physical. Like I've had several patients, as I start freeing up scars, they just start sobbing on the table. And it just releases some of that stuck energy that we were talking about earlier from how they got the scar in the first place. But you can also do massage, you can do acupuncture,
Yeah,
mount
you can
pumps
do
to help
this.
with some
Yeah.
of those restrictions as well.
Yeah, but
Yeah, I mean, this is actually a huge issue, and it's almost almost never discussed by surgeons going into surgery, right? I saw so many people that had surgeries and then had severe pain. And again, most times when you go in, that's not even considered when you're having a pain issue, right? Especially if it's a chronic issue, you have the surgery and the scar can develop over time. And this could be something superficial in the skin, connective tissue, the fascia. It could be deep inside the body if you have a inter-abdominal or a deeper surgery. Scarring could happen through those tissues as well. And I think certainly, the more we see people that are nutrient deficient, the more prone they are to having scarring. So I think we're seeing more and more issues with that as people are eating, less nutritious food and mineral deficient food in particular. I've seen silica is the probably the most critical mineral I've seen, where people have surgery and they have a tumor of scar. Like not only does the skin scar, but then it keeps growing, and they actually have a mass or big scar tumor growing. Silica is the best to address that I've seen, and so I always tell people if you have surgery, increase your silica. So have some chicken broth with the chicken feet and tissue that has high silica, or supplement with the good quality natural silica.
Got it. Okay. Can you talk about phantom pain, where someone who hasn't had an arm or leg amputated still feels pain in that amputated limb? Is the pain in the brain? There's also, just to say, and I'll let you guys say, there's a difference also between, and Adam, you were alluding to this too. There's a difference between pain and suffering.
Mm-hmm.
And that's an important distinction. But yeah, what about phantom pain? Anybody have any?
I mean, it's a real situation where someone they have a certain part, usually it's most common to be like a foot, right? A diabetic person has a necrotic foot, where their foot is now affected, the tissues, necrotic and infection spreading, and they'll have that part of the body, removed, surgery. And yet the person will continue to have the perception that they have the foot there and severe pain in the foot. And so I think there's that type of pain, and then there actually can be like stump pain. So at the end of, like, if they cut it off at the knee, they could have severe pain at the knee. So it shows again that there's damage here, right? And when you injure, if you're cutting the nerve, although you can cut off that area, right? And that might temporarily cut the pain off, like Tom said, the pain may come back because of the injury to that nerve. And so it's a tricky thing. I haven't seen anyone in the last few years with that, but I will say, is one of the most powerful things coming back to nutrition again is fats, right? People that are fat deficient are really, really prone to, nerve pain, neuropathic pain. We call it like neuropathy, right? And when you can really replete someone with fat over time, I've seen that to do wonders for nerve pain, nerve injury.
Okay. What is our take on cold plunges for pain relief? Anybody have any thoughts on that?
Yeah, I mean, again, I think there's a lot out there now, right, in kind of your functional and alternative health about that, and they get into the weeds, I think, on what's happening at a chemical level. I think I think that type of stress on the body, can build up resilience in your body, especially with the nervous system. So I think people that do like a hot sauna, and then do a cold plunge, the effect afterwards is they tend to be able to be in a more balanced nervous system. So I think, again, from a nervous system perspective, especially, or balance in the body, I think that can be quite helpful. It's not necessarily a cure-all, right? So again, if the person, we find that some people, they're able to do that and they hold that state, right, where they're very calm and it's beneficial. Some people, they'll see a very short benefit and then they're back into pain. And again, it's because there's these other factors we've talked about that probably aren't being addressed as well.
Yeah, I've seen a lot of benefit outside of like a true cold plunge where you're jumping into an ice bath, but even just doing the contrast baths. So, and it's not like ice water and hot, it's lukewarm and cool. And you just go back and forth with the painful extremity or whatever you're trying to treat. And just that take, I think, is enough to help with that regulation of the nervous system to start bringing pain levels down for a lot of things.
I wonder if it's a question of there's on the one hand, doing nothing to stress you is a
Mm.
bad strategy because you get weak. That's like the weather deficiency syndrome, where they grow plants and animals it's always 70 degrees, same humidity, etc., and you get really weak plants and animals. So you can't do that. And on the other hand, if you make your life so difficult and so unpleasant and so freezing too much of the time, that's not good. That's not fun either. So a little, so what's the right amount? I think that depends on the person. And somehow it's again comes back to trusting yourself. This feels good and this doesn't, and see what happens.
Absolutely agree with that, right? I think that's similar to exercise or even heat on the other side. If people get prescribed amounts to do and they aren't able to do that and they can overexhaust themselves, they can kind of put themselves in a bad
Yeah.
position. So
Yeah.
there needs to be balance in this for sure.
And you're the judge, you, the person. Okay. If pain develops due to bad thoughts and negative emotions, how can the tissue heal? I would only point out, I don't know what a bad thought is or a negative emotion. They're just thoughts and emotions. Some thoughts, as we all know, are incorrect. And some emotions are problematic in the sense of that's maybe somehow not what's happening, but it's still, they're there to be felt and thought. That's, I think, the first step. I don't know if you guys have any.
I think it goes back to balance though, because even if that thought is there to think, if you are inundated with those more negative or those more harmful, some people may perceive them as harmful emotions because they're constantly bringing you down, they're constantly putting your body in or brain in more of a stressed state, then that takes a toll on the body. It takes a toll on the energy. I think even like from a whole body standpoint can probably increase inflammation throughout the entire body, which does make it hard to heal. So there's so much to be said for how we talk to ourselves and the thoughts and the emotions that we're putting in and cultivating that more positive energy. I would say if you're kind of stuck in that pattern, one of the easiest ways to get out of it is to just go ground. Like if you are having trouble getting your mind out of that state, putting your body in a state where it's actually getting fed despite what you're telling it can actually help pull some of that thought process out. And then you're outside. Like there's other things that are factoring in to help lift your whole spirit. So yeah, I do think that can affect healing from just a like whole body standpoint and how energetic we are.
And just one thought too along those same lines is, again, if it's our self-talk, right, our self-thoughts are really dragging us down, maybe those around us, seeking out someone else that can lift us up. And hopefully, again, that's probably a part that all of us here at New Biology, sometimes we can get that kind of external, whatever you want to call it, energy or something to kind of lift us up, give us hope. There's so many people I've talked to that have, seen multiple doctors and it's doomsday, or they saw a dentist, and if they don't get this tooth removed in 2 weeks, they're gonna go to the brain and they're gonna be dead. And I tell them that's not true. I don't see that happening at all. Let's go through, see what's happening, and all of a sudden that lifts up everything. And so sometimes you might need, yeah, some external, again, earthing, do some breathing, maybe try to find someone that can lift us up. So
It's interesting. It's a little bit off subject, or maybe a lot, but there's so much of that in our culture. I mean, if you don't believe me, go watch An Inconvenient Truth by Al Gore. I mean, we're definitely all dead. We died 20 years ago from catastrophic glacier melting. I mean, go read Paul Ehrlich, 2005, the Earth was uninhabitable. And we get that all, anyways. So yeah, you don't have to believe that, any of that stuff. So I heard that fish oil supplements help with internal scars. Is this true? By the way, I never would recommend a fish oil supplement. That's the first thing. Cod liver oil, yes, but not just fish oil. So I don't know.
Yeah, I agree 100% with that, right? There might be healthy oils in different fish, right? And that, but those in general supplements are toxic rancid
Yeah,
oils that you're
yeah,
finding. So, but yeah, I mean, certainly fat and oil is beneficial for healing.
yeah.
So,
Just eat real fat.
Yeah. Well, and I think the fish component, looking at omega-3s, whatever that actually really is, but there seems to be an anti-inflammatory response of the body when you're eating more of those types of foods. So again, sourcing from a whole food source is always going to be better for the body and easier for the body. But that can help with that healing process, like Adam was talking about earlier. It goes back to having a healthy diet so your body can respond well. So good fats, healthy fats, fish can be good fish, can be a really good source of that.
Yeah, and to me, to make it not to get out of that biochemical thing, but it's sort of a marker. They say omega-3 was cows that eat grass and fish that are wild and eat plankton. At the end of the day, the question to ask oneself is, what's the best diet for a cow? Grass. What's the best diet for a fish? They swim around. I don't know what they eat. That's the kind of fish and cow I want to eat. You don't have to know any more biochemistry than that. Uh, all right, last one. Why does pain develop from sleeping positions and mattresses? I've actually had that. So, you guys have anything to say about that?
I think a lot of us have experienced this. A lot of it has to do with, I think, well, two things, stagnation, but also just stress on different parts of the body. So if
Yeah,
your mattress is breaking down, it's going to allow your hips to sink in or your shoulders to sink in, and that just puts your body in a weird position. So that's putting a lot of stress on the hips or the low back or the neck or whatever part of the body is not in alignment. So just supporting that and getting a more firm mattress, or some people would even say sleeping on the floor with just maybe a little thin mat is the best way to keep your body in line and really support your body from that perspective while you're sleeping. So I think that and just causing some stagnation while you're not moving over time, especially if you already have a predilection to pain problems, you may get up feeling more stiff or more achy until you start moving around.
yeah,
and then just to add real quick onto that, because that was one of the last thoughts I had just generally is that sleep is so important, right, for our overall functioning. Like if you're having an issue with pain from an injury, it will amplify if you're not getting good sleep. So
Yeah.
it's not necessarily highly regarded again in our society to prioritize sleep. It's kind of a badge of honor in the medical field. The least amount you sleep and the more call you took, at least when I was doing it. But it's a road to poor health for sure. So
yeah. Okay, guys, thank you. And thanks for everybody for joining us. And see you again.
Thank
all
you.
right, thank you guys. Bye bye.
Bye.